Stay safe, stay alive. Welcome to another session with Dr. Fresh. So today is World Diabetes Day. Leading cause of amputation in the world is diabetes mellitus. I'm talking about diabetes type 2 diabetes. Now, the theme is access to diabetic care. Access to diabetic care. If we talk of diabetes, we are talking of sugar in the blood. There are people who have excessive sugar in their blood and then they know themselves. Now, in this context, who are those that should access diabetic care? Who are those that should be primed to access diabetic care? Number one, if you have the family history of diabetes, as your father or your mother, your elder brother, your elder sister had diabetes, you should look at it very, very well. Basically, familiar. Mother, father. Secondly, if you are overweight, you are obese, 3 in 1. You know yourself, you have high cholesterol, you are on this list. The reason is this: diabetes puts you at risk of a lot of complications. Then if you are hypertensive, you should get yourself screened. There are so many tests that can be done in the screening of diabetes, but the most reliable test is called the glycated hemoglobin because it gives you a picture of the sugar in the blood over the last 2 to 3 months. What are the commonest complications that could arise as a result of diabetes? It's good you know, just in case you're having a complication, you may be unaware. Number one complication, usually they cause loss of sensitivity in different parts of the body. And then that's why you see a lot of persons that with diabetic mellitus, as it were, they would match a nail, a pin, they will be unaware. They will be bleeding, they will be unaware. And usually this is the bedrock of amputation. Secondly, the diabetes can affect their eyes, the retina of the eyes, and they begin to have diabetic retinopathy, and in the long run to impair their vision. Thirdly, it could affect their kidney as diabetic nephropathy. The nephrons of the kidney, the sugar level begin to have. Well, you may not appreciate that whole explanation in this concept, but just know that it could affect the kidneys. Next, you also appreciate the fact that the sugar level could get so bad that it begin to affect different systems in the body and it could culminate in death. Having said this, we should be at alert to detect the risk factors for those who are high risk and then act accordingly in good time. Take the step, stay alive, act well, lose that weight, take your medication, cholesterol, take your medication, your drugs, and if you're on injection, take it, use it judiciously so that you can make the most of the life God has given to you. I wish you the best. Stay safe, stay alive.